Hi, I'm Sam. I'm going to be your nurse today. I'm just going to wash my hands really quickly. Alright, I'll wash my hands. I'm providing us with some privacy. I'm checking the area to make sure that it's safe for you and I. May I look at your wristband really quick? Alright, what's your name and date of birth?
Jasmine Bailey,
Date of birth?
12596.
Perfect. So, Miss Bailey, I'm just going to do a head, neck, and neurological assessment on you really quick. Before I get started, are you comfortable?
Yes, ma'am.
Okay. So the first thing we're going to do, I'm just going to ask you a few questions. Do you know who the president is?
Biden,
Good job. And do you know what year it is?
2021.
Perfect. And do you know where you're at?
The hospital.
Alright, so the patient is alert and oriented times 3. The speech is appropriate. Her voice is strong. It's not hoarse. It's not garbled or slurred. Alright, so the first thing I'm going to look at is your head. Have you bumped your head recently?
No.
Okay. So the head is normocephalic. Hair is distributed evenly. There's no bumps, lumps, or lesions noted. There's no parasites noted. Her eyebrows and eyelashes are distributed evenly. There's no redness, drainage, lesions noted. I'm just going to pull down on your lower conjunctiva. Alright, so there's no excessive redness, drainage, or foreign bodies noted in the lower conjunctiva. Alright. So the pupils are about 6 millimeters and they are round and symmetrical. So what I'm going to do is I'm going to shine a light in your eye really quickly. So I need you to just stare at my nose for me, okay? Good job. Alright, perfect. So if you could just follow my pin for me. Perfect. So there's a chart over here. It's called the Snellen chart. I'm going to have you stand up right here. You're about 20 feet away. I need you to cover one eye. Read the lowest line you can see.
BELL.
Good job. Now cover the other eye and read the lowest line you can see.
BELL.
Alright, uncover both eyes and read the lowest line you can see.
BRAN.
Perfect. So the patient is about 20 feet away. She can see at 20 feet what people without any visual disturbances can see at 20 feet. Good job. You have 20/20 vision. Alright. So cranial nerve number 2 is intact. Pupils are round, even, symmetrical. They're reactive to light and accommodation. So I'm just going to stand behind you. I'm going to have you cover an eye. And I want you to tell me when you can see my hands, okay?
No.
Other eye?
No.
Alright, uncover both eyes.
No.
Great job. Alright, now just follow my fingers for me. Good job. So the eyes move evenly, and there's no jittering. Cranial nerves 3, 4, and 6 are intact. So now I'm going to touch your face, and you close your eyes and tell me exactly where I'm touching on your face, okay?
Forehead. Chin. Nose. Left cheek. Right cheek.
Perfect. So now can you raise your eyebrows up? Lower them. Smile real big with your teeth. Frown. How about your cheeks? Good job. Now clench your teeth together. I'm going to try to move your chin, but don't harm me. Alright, good job. So cranial nerves 5 and 7 are intact. Now I'm just going to push your hair back behind your ears. Perfect. Alright, so the ears are symmetrical. They're perfectly sized, shaped, and placed. There's no redness, drainage, or lesions noted. I'm going to touch on your ears. I just want you to tell me if there's any jitters, okay? So I'm pulling on the pinna, and I'm pushing on the tragus. Was there any tenderness?
No.
Alright, so there's no tenderness noted on when I pull on the pinna or push on the tragus. I'm just gonna look inside your ears now. I'm gonna do this by pulling up and back on the pinna. Alright, so there's no redness, drainage, lesions, or excessive cerumen noted. Now I'm gonna have you close your eyes. I'm gonna rub my fingers together. I need you to tell me which side I'm rubbing my fingers, okay?
The left. Right.
Perfect. So cranial nerve number 8 is intact. Looking at the nose, your nose is midline. It's not deviated. There's no redness, drainage, or lesions noted. Ms. Bailey, could you tilt your head back for me? The nasal septum is midline. Mucosa is pink and moist. There's no excessive redness, lesions, or drainage noted. So now could you cover one ear for me and sniff? Cover the other ear for me and sniff. Have you had any issues smelling here recently?
No.
Alright, perfect. So both ears are patent, and cranial nerve number 1 is intact. Now looking at your lips are pink and moist. There's no lesions noted. Could you open up your mouth for me? Alright, teeth are intact. There's good oral hygiene. Teeth are in appropriate repair. There's no discoloration or bleeding in the gums. Mucosa is pink and moist. No lesions noted. Can you stick out your tongue for me? Move it up, down, side to side. Perfect. So the tongue is pink and moist, appropriately rough. There's no lesions noted. There's full range of motion of the tongue, so range of motion is appropriate. Could you stick out your tongue and go off for me real quick? Alright, so tonsils are 2+, no exudate date is noted. There's no redness, drainage, or lesions noted. The uvula is midline and it does rise with phonation. Alright, good job. So have you had any issues swallowing?
No.
So I'm just going to put my hand on your neck really quickly. Could you swallow for me? Alright, good job. So muscles are smooth and strong, so cranial nerves 9, 10, and 12 are intact. Alright, so now that I'm looking at your neck, there's no masses, bumps, lumps, or lesions noted. So what I'm going to do is I'm going to have my hand at your face. I just want you to turn your head towards my hand, okay? Good job. Now the other side. Great job. Now could you shrug your shoulders for me? Perfect. So neck and shoulder strength is equal bilaterally. Cranial nerve number 11 is intact. So now I'm going to stand behind you. I'm just going to fill on your throat. What I'm filling for, I'm going to find your trachea. I'm just going to move it gently. If you can take a big swallow for me. Alright, so the thyroid is not palpable. Now I'm going to palpate your lymph nodes. Submental lymph nodes is not palpable. Submandibular lymph nodes are not palpable. Tonsillar lymph nodes are not palpable. Periauricular lymph nodes are not palpable. Postauricular lymph nodes are not palpable. Anterior cervical lymph nodes are not palpable. Posterior cervical lymph nodes are not palpable. Occipital lymph nodes are not palpable. I'm just going to fill underneath your shirt right here on your clavicle. Clavicular lymph nodes are not palpable. So no lymph nodes are palpable and the thyroid is not palpable. Alright, so now I'm just going to test your coordination. If you can close your eyes, put your arms out at your side. Alright, do one finger to your nose. Now do the other one. finger to nose test is accurate. Good job. So now I'm going to have you take your heel and go up your shin. Good job. Now the other one. Great job. So heel to shin test is accurate. Now I'm going to have you stand straight. You're going to put your feet together, your arms by your side. I'm going to be here to support you just in case. You can close your eyes. We're going to have your eyes closed for 20 seconds. Alright, so 20 seconds is up. There's no movement, so Romberg's test is negative. You may have a seat. Alright, so now I'm going to check your reflexes, okay? So what I'm going to do is I'm going to hold your arm. I just want you to let it dangle. I'm feeling above her elbow, about 3 inches. We're going to test your tricep muscle. I want to get between my 2 fingers. Alright, good job. Alright, sorry about that. Good job. So tricep reflexes are intact bilaterally. And I meant tendon, not muscle. Alright, so now we're going to check your biceps. I'm just going to provide some tension. Then you have about 2 inches above the crease of her arm. I'm checking for a twitch. Right? Alright. Bicep reflexes are intact bilateral. Now I'm checking the brachioradialis reflexes. I'm going inwards about 1 inch. I'm checking for a twitch of the thumb. Good job. Excuse me. Wash my hands. Alright. Brachioradialis reflexes are intact bilaterally. Now if you could just let your legs dangle for me. I'm going to check your plantar reflexes. Looking for a crease right here in the knee. Just let them dangle. Alright, good job. Alright, plantar reflexes are intact bilaterally. So now what I'm going to have you do is just stand up if you don't mind. Turn around and put your knee in the seat. I'm just checking your Achilles reflexes. Right, good job. Now do the other one. Alright, so Achilles reflexes are intact bilaterally. I'm going to turn around and have a seat. Excuse me, I'm just going to take a breath really quick. Wash my hands and then bring them. Alright. Can you put your foot up here for me? Alright. Now I'm going to check your plantar reflexes. I'm going to do this by using this end to go up and make a loop around on her plantar. Checking to see if the toes curl. Good job. Now I'm going to do the other one. Alright, so plantar reflexes are intact bilaterally. Great job. So all reflexes are intact bilaterally. So I'm going to have you squeeze my fingers until I say stop, squeeze. Alright, you can quit. Alright, so hand grip is intact bilaterally. Gonna have you put your foot back up here for me. Alright, so I want you to push the gas pedal. Good job. And then up towards your head. Good job. Now the other one. Push the gas pedal. Good job. Up towards your head. Alright, plantar and dorsiflexion is strong and equal bilaterally. Now if you could spread your fingers apart for me, close your eyes. I I'm gonna pull a finger for ceiling or floor. Tell me which one it is.
Ceiling. Floor.
Alright, good job. Finger test is accurate. Alright, so what we're gonna do now is I'm gonna do a sharp dull test on you. So I'm gonna do 2 times on each limb. This is what sharp feels like. This is what dull is gonna feel like, okay? So close your eyes for me.
Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull.
Alright, dull sharp test is accurate. Alright, do you have any questions about your procedure tomorrow or anything?
No, thank you.
Alright, so I'm going to wash my hands. I'm going to remove privacy. I'm going to be back in about an hour. If you have any questions or you need anything before then, here's your call bell. It's going to be this red button. You just press it if you need me, okay?
Thank you.
Alright, thank you so much.